Thank you, Mr. President. I rise this afternoon on behalf of the independent bench to pay tribute to Dr. Daphne Phillips-Gaskin. As we've heard from colleagues in their contributions, she was a scholar, a sociologist, a former minister, a former senator, a community advocate, a nurse, and a woman whose public life exemplified the deep connection between rigorous academic work and meaningful national service. In making this tribute, Mr. President, I also pay tribute to my former UWI St. Augustine colleague. Dr. Phillips spent more than 2 decades at the University of the West Indies St. Augustine campus. She was my colleague in the Faculty of Social Sciences, and we were actually office neighbors since we occupied offices on the same corridor. I had the privilege of seeing her dedication and quiet strength up close. Before she entered political office, Dr. Phillips was, above all else, a sociologist. She was a scholar who examined the structures, the systems, and social forces that shape everyday life in Trinidad and Tobago. At the UWI Faculty of Social Sciences, she lectured in sociology, social policy, and the sociology of health. Her students remember her as a demanding but deeply compassionate teacher, someone who insisted that social science must illuminate the lived realities of ordinary people. Her research, published in journals such as Caribbean Dialogue and International Sociology, shaped regional thinking on health and society. Her influential 1986 article, The Politics of Medical Dominance in Trinidad and Tobago, published in the SAGE journal International Sociology, examined how structural inequalities and professional hierarchies influence patient experience and access to care. Long before the terms health inequity and structural violence became part of mainstream policy discourse, Dr. Phillips was interrogating the power relations embedded in our healthcare system and calling for a more humane, equitable model. Her scholarly work extended to nurse migration, youth development, community resilience, and the social roots of public health challenges. Across her academic career, she asked difficult but necessary questions, including, why do our healthcare systems continue to marginalize the very people they are meant to serve? How do race, gender, and class shape access to care and justice? What structural changes may be necessary to make development truly people-centered? In many ways, her sociological lens became the compass of her public life. She approached society not as a set of problems to be administratively managed, but as a living system of people whose dignity and well-being required deliberate, thoughtful, and evidence-based action. Dr. Phillips was part of a rare tradition in Trinidad and Tobago, scholars who bring their academic training to bear on national policy. As noted earlier, she served in several parliaments, and her legislative contributions reflected her sociological preoccupations with justice, opportunity, and the structure of community life. Among the bills she debated were the Domestic Violence Bill, the Equal Opportunity Bill, the Consumer Protection legislation, and measures relating to gender affairs, culture, and community empowerment. These are not, Mr. President, incidental details. they reveal a policymaker who saw the state not merely as an instrument of administration, but as a mechanism for equity, protection, and social transformation. A colleague who worked with Dr. Phillips in the sphere of gender affairs remembers her as Minister of Community Development, Culture, and Gender Affairs, and later as a senator who championed the idea that development must begin with strengthening of people's capacity to participate in society, to work, to create, to belong, and to thrive. Her legislative record shows consistent attention to the everyday struggles of households and communities, especially women, working families, and those whose voices are least heard. Dr. Phillips assumed the portfolio as Minister of Gender Affairs at a pivotal moment, just after the landmark 1995 Beijing conference, when global conversations on gender equality were deepening. It was Dr. Phillips who first moved to shift the national discourse from women's affairs to gender affairs, recognizing that meaningful transformation required understanding the full spectrum of gender relations in Trinidad and Tobago. She was the minister who insisted on grounding policy in the lived realities of both women and men. As part of this work, she initiated projects such as homework centers and skills training programs in non-traditional areas, thereby opening new pathways for economic participation, particularly for women and young people. Her colleagues remember that Dr. Phillips was the first minister to formally engage a committee of men so that she could better understand their perspectives, an early recognition in our national space that progress in gender justice required insights and participation of men as well. What stood out most, however, was her approachability and humility. Despite the trappings of ministerial office, Dr. Phillips was known for truly listening to even the youngest members of her teams. She was not swept up in ceremony or status. She was described simply and powerfully as an excellent minister, one whose sincerity, curiosity, and willingness to learn made her leadership both effective and deeply human. This testimony reinforces what her parliamentary and academic record already shows, that Dr. Daphne Phillips brought to every role, lecturer, sociologist, minister, senator, a profound respect for people and a desire to shape policy that resonated with the social realities of those she served. Dr. Phillips embraced her degenerative illness with extraordinary candor and courage. Rather than retreat, she transformed her private struggle into public advocacy, co-founding and later leading the Multiple Sclerosis Support Foundation of Trinidad and Tobago. Through that work, she helped bring visibility to a condition that often leaves people feeling isolated and unseen. Mr. President, as I close this tribute, I say that Dr. Phillips's journey offers 3 enduring lessons for us in this chamber. First, Dr. Phillips showed that academic insight enhances public policy. In an era when debate can be driven more by rhetoric than reason, she demonstrated that evidence and scholarship still matter, that good sociology could illuminate good governance. Second, her work affirmed that social policy, gender justice, community development, and culture are not peripheral to national progress. They are central to the health and resilience of our society. The bills she debated, the ministries in which she served, and the research she produced all reflected a unified vision. that a nation must be judged by how it treats its most vulnerable and how it builds belonging. Third, Dr. Phillips's courage in the face of long-term illness reminds us that public life is not merely about positions held, but about character demonstrated. Her perseverance, generosity, and advocacy for persons living with chronic conditions speak to the best of our civic tradition. Mr. President, on behalf of the independent bench, I extend sincere condolences to her family, her friends, her former colleagues in academia, the Multiple Sclerosis Foundation, and the communities she served across decades. We thank them all for sharing her with the country. Dr. Phillips leaves behind a legacy made not only of bills debated and policies shaped, but of minds mentored, systems interrogated, communities uplifted, and people empowered. She embodied the conviction that scholarship must serve society and that public service, when grounded in compassion and evidence, can indeed shape a more just and humane Trinidad and Tobago. Mr. President, in remembering Dr. Phillips, may she rest in peace and may perpetual light shine upon her. Thank you, Mr. President.